welcome back to Orthopaedic Associates home instructions for your shoulder rotator cuff exercise protocol. Today we're going to talk about phase 3 of your rehab, which is 3 months out of surgery. First, we'll go ahead and start off with your reachers and preachers. If you remember, in phase 2, you're going to be raising straight up, forward in your shoulder flexion or reacher position, and now we are putting 1-pound dumbbells or a lighter weight to lift them against gravity. So this is what it looks like in the forward position, and this is what it looks like from the side. Always chest up tall, shoulder blades back. Second, we have the preacher position, shoulder scaption, chest up tall, shoulder blades back. 1-pound weights in our hand, we're going to lift up, we're going to come down, and then we're going to come right back up. If I have a shoulder hike with this position, if I have a significant discomfort, I'm going to stop and try to make the range of motion smaller, pain-free, or I'm going to adjust my posture to make the pain go away. We are never working out through pain or causing compensations. The next exercise in phase 3 of your rotator cuff protocol is going to be using a rubber band to do external shoulder rotation with my arms by my side. As you can see, I've got my band out in front. It's a light weight. I'm shoulder width apart, and I'm rotating away from my hands. Coming back in halfway, right back out. I'm doing a set of 10, 15, 20 times, trying to get a burn behind my shoulder. I'm not trying to have pain in the front of my shoulder or down the side of my arm. Chest up tall, shoulder blades back as always, and we're trying to do 2 to 3 sets, 10 to 20 repetitions, just like I'm doing with the small weight. All right, here we are, phase 3, shoulder rotator cuff protocol, doing resisted TheraBand internal rotation for my left shoulder. The band is going to take my arm out away, my elbow stays close to my side, chest up tall, and I pull it in. Again, I'm going to do 3 sets of 10 to 20 repetitions. Got to be 100% pain-free in my shoulder. If I need less resistance in the band, I'm going to step toward the door and repeat the movement. If I need more resistance, I'm going to step away from the door. The band starts here at the neutral gunslinger position. It pulls me out 45 degrees, and then I pull it in 45 degrees. Notice there's no major elbow movement. Elbow stays tucked to my side, chest stays tall, 10, 15, 20 times. Okay, now we're going to show you the sleeper stretch. The sleeper stretch is a common stretch for the posterior shoulder to allow people to reach behind their back or lift over their head better, or lift or reach across your body. So in the sleeper stretch, the shoulder we're stretching, we're going to lie on that side. So Kendra is in right sideline. Her shoulder is out in front of her at a 90-degree position from her body, and her elbow is up here at a 90-degree position. Again, as always, she's chest up tall, shoulder blades back, and the movement here is going to be with her left hand is going to take fingertip pressure on her forearm, and it's going to roll her arm down at a slight angle towards her belly, and she's going to feel this stretch back here. And if she goes chest up, shoulder blades back, it's not a big movement. Right about there, she should feel a mild stretch behind her shoulder. Again, holding it gently, maybe 10 seconds or so, letting out of it easy, and then repeating. Things we want to be aware of and not push through would be pain in the front spot of your shoulder or pain going down your arm in the front. Okay, here we are, staying with our posterior shoulder stretches, kind of advanced stretching here. If we're looking at the right arm and we want to stretch the back of the shoulder here, or the posterior shoulder, we can do this modified butterfly stretch, where if you lift your head, Kendra, and let your hand go behind your head, now relax here. Take your left hand, Kendra, grab your elbow, and pull that elbow medially or towards your nose. And as you can see here, as she gets her arm closer to her face, we are now elongating or stretching the back side of the shoulder. This is a nice, easy, common stretch to do, especially earlier on in either phase 2 or phase 3 of your rehab protocol. We're going to do a bilateral butterfly maneuver with the arms. So if Kendra, you can put your hands behind your head. Good. Let your elbows come in. Good. We're trying to get both elbows to go to the center equally, and now let your elbows go out. Good. Pinch your shoulder blades back. Try to pull your elbows down towards the bed. Good. And repeat 5 to 10 times. Phase 3 strengthening exercises for your shoulder. We're going to demonstrate here the skull crusher maneuver or the long tricep strengthening exercise. So we're going to bring the weights down, keeping your arms perpendicular to your body. Let the weights come towards the side of your head, and then press them straight up. 1. And let's do that 5 to 10 times now. Good. Notice she's stabilizing her shoulder here. 2. The weights are staying off her head. 3. 4. We'll do one more here. This is a 2-pound weight. You may want to start with no weight at all and then progress to 1 pound and 2 pound from there. As always, we never try to go greater than 1 pound a week when we're doing our strengthening. Okay, staying with our shoulder strengthening in phase 3. In this supine position, we can also do shoulder flies. We can let the weight come out to the side, kind of halfway, come back to the center. 1. And let's repeat that 5 to 10 times. And whenever you first get started, you always want to keep your movement small and only get bigger if you can do the movement in a controlled manner and a pain-free manner. Notice there's no major shaking or major discomfort coming from this maneuver, so we feel comfortable maybe going out just a little bit farther. Good. Now come back in. Great. Good. Again, this is the shoulder fly exercise in the supine position. We're going to do bicep curls. Let the weights come down by your side and go ahead and pick the weights up. Good. And down. 5 to 10 times. If you feel anything at all, it should be a muscle burn or a fatigue in the front of your arm here. We should have no pain in your shoulder or on the top of your shoulder or in the back of the shoulder. Notice her arms by her side, her body is not rocking, and there's no compensations going on with this movement. Okay, so now we're going to demonstrate the corner stretch, a very common stretch that we can do to kind of open our chest up and externally rotate or stretch our arms out to the side. So find the corner of a room at home. We're going to walk up to the corner. We're going to place your arms out to the sides on the walls. Elbows are on. Good. Always chest up tall, shoulder blades back. We're going to pick one leg. Go ahead and put your one foot closer to the good. The corner, you're going to gently lean into it. Good. And what you're going to do is feel a stretch in the front and a little straightening on the back. And hold this stretch 5 to 10 seconds. Make sure it's comfortable. If your shoulder's significantly tight, this is going to be a very difficult stretch for you. You're going to come out of it. If your arm's up too high or too painful, you can bring your arms down. Try to work a little modification this way. Now lean into it. That'll be a little bit easier on your shoulder. Good. And if that's still too discomforting, now take a step back, Kendra, from the wall. Good. Stay in the same position, one leg forward. Good. Have your elbows off the wall now, hands on, and now gently lean into it. This is another modification for you if it was too discomforting to have your elbows on the wall. Again, we're 2 to 3 times, 10 seconds or so on your stretch to start. You can always do it longer, and this is in the phase 2 or phase 3 of your rotator cuff protocol.